Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of this audio podcast series, as part of this audio podcast series or edition as part of a laboratory inquiry. This audio podcast as part of a Helm in BackRow. This audio podcast as part of a Helm in Rudder. This audio podcast as part of a Storm Robotics production. In this audio podcast, looking at now the sort of conclusion, the sort of conclusion as part of this peer-reviewed and published works from 2023. So after documenting interviews were critical in generating themes in preparation for inductive content analysis implementation. 19 interviews between four cohorts were conducted with a requirement to respond, and this research informed that there is scope for educational service development and initiatives focusing on AHP involvement, allied healthcare professional involvement, but there needs to be a coordinated effort between healthcare service users and providers. So point of care education could be integrated through online space. Through online space, for example, the RPS through the RPSG, for example, and linked to electronic patient records or APRs. Educational support is thus required, wherein there is access to AHPs, allied health professionals, prompting advice, guidance and support through online spaces aligned to traditional physical consultations. And this research informs that co-developed education modules could be delivered between healthcare service users and allied healthcare professionals. Education modules could be linked through social media platforms, integrating a sort of proposed educational pathway for CKD healthcare service users, so that public health and research meet practice excellence. That draws this audio podcast to a close. This audio podcast as part of a laboratory inquiry. This audio podcast as part of a Helm in BackRow. This audio podcast as part of a Helm in Rudder. This audio podcast as part of a Storm Robotics production.